Rhabdomyosarcoma is an oncological disease. Look at this picture, shows that signs and symptoms and parts of body possible to affect. Then for diagnosis, CT scan, MRI findings, look at this, and PET scan, look at this. Then X-ray findings. Detail going on. Introduction. Rhabdomyosarcoma RMS is a rare and aggressive malignant tumor arising from striated muscle cells. It is the most common soft tissue sarcoma in children and adolescents, but can occur in adults as well as RMS can develop in various parts of the body, including the head, neck, genitourinary system, and extremities. Rhabdomyosarcoma is a malignant neoplasm originating from private mesenchymal cells that differentiate into skeletal muscle. It is classified as a soft tissue sarcoma and is known for its rapid growth and potential for metastasis. Etymology. The term rhabdomyosarcoma comes from three Greek roots. Rhabdo meaning rod shaped or striated, myo meaning muscle, and sarcoma meaning malignant tumor of connective tissue. It refers to a cancer that arises from skeletal muscle cells, often in children and adolescents. Type Types 1. Embryonal rhabdomyosarcoma ERMS, most common in children under 10 years, often found in the head, neck, and genitourinary tract. 2. Alveolar rhabdomyosarcoma ARMS, more aggressive and common in older children and adolescents. Typically affects the extremities. 3. Pleomorphic rhabdomyosarcoma, rare, mainly occurred in adults and is highly aggressive. 4. Spindle cell sclerosing rhabdomyosarcoma, a variant with better prognosis in infants but aggressive in adults. Causes. The exact cause of RMS is unknown, but genetic mutations and environmental factors may contribute to its development. 1. Genetic mutations. Example PAX3 FOX01 fusion gene. 2. Familial cancer syndrome. Example like Frumini syndrome, neurofibromatosis type 1. 3. Radiation exposure. Prenatal or childhood. 4. Embryonic muscle cell dysregulation. 5. Environmental carcinogens. Example chemical exposure. Risk factors. 1. Genetic syndromes. Example like Frumeni syndrome, a back with Wiedemann syndrome. 2. Family history of cancer. 3. Exposure to radiation or chemicals. 4. Congenital abnormalities. Complications. 1. Metastasis to lungs, bones, or lymph nodes. 2. Treatment related side effects. Example chemotherapy induced toxicity. 3. Recurrence of cancer. 4. Organ dysfunctions depending on tumor location. Pathophysiology. RMS originates from mesenchymal cells that fail to differentiate into normal skeletal muscle. Genetic alterations such as PAX3, FOXO1, or PAX7, FOXO1 fusion genes are often implicated in ARMS, leading to uncontrolled cell proliferation and tumor formation. Pathophysiology of rhabdomyosarcoma RMS step by step process. 1. Genetic mutations and molecular alterations. RMS arise due to genetic mutations that leads to uncontrolled cell growth. Common mutations involve PAX3, FOXO1 and PAX7, FOXO1 fusion genes in alveolar RMS, or mutations in TP53, RAS, MIOD1 and FGFR4 in embryonal RMS. 2. Dysregulated cell proliferation. These genetic changes cause abnormal activation of growth promoting pathways, including the PI3K, AKT, mTOR, and RAS MAPK pathways. This leads to excessive and unchecked proliferation of primitive muscle cells. 3. Loss of differentiation. Normal skeletal muscles cells undergo differentiation to become mature muscle fibers. But in RMS, differentiation is halted. Rhabdomyoplasts remains in an immature state, preventing functional muscle formation for local inversion and tumor formation. Rapidly growing rhabdomyoplasts from a solid tumor mass that infiltrates nearby tissues. The tumor can invade surrounding muscles, fat, and even bone, depending on location. 5. Angiogenesis, blood supply formation. Tumor cells stimulate the formation of new blood vessels, angiogenesis, via VEGF, vascular endothelial growth factor, ensuring continuous oxygen and nutrient supply for tumor growth. 6. Metastasis, spread to other organs. Tumor cells gain the ability to break away and invade blood or lymphatic vessels. Common sites of metastasis include lungs, lymph nodes, bone marrow, and the central nervous system. 7. Immune evasion and resistance. RMS cells develop mechanisms to evade immune detection by altering immune checkpoints PDL1 expression. Some tumors also become resistant to chemotherapy through mutations in drug resistance genes. This step-by-step process explains how rhabdomyosarcoma develops, spreads, and evades treatment. Signs and symptoms. 1. Swelling or mass in affected area. 2. Pain or tenderness at the tumor site. 3. Restricted movement if affecting limbs or joints. 4. Vision problems if the orbit. 5. Urinary or bowel dysfunction if in the genitourinary region. 6. Respiratory distress if in the thoracic cavity. Diagnosis. 1. Physical examination, assessment of limb swelling or pain. 2. Imaging tests, MRI, CT scan, X-ray, PET scan. 3. Biopsy, core needle biopsy for surgical biopsy for histological analysis. 4. Genetic testing, identification of fusion genes or chromosomal abnormalities. 5. Bone marrow aspiration to check for metastatic spread. Nursing diagnosis. 1. Acute pain related to tumor growth and treatment. 2. Risk for infection related to immunosuppression from chemotherapy. 3. Imbalanced nutrition less than body requirements related to cancer treatment side effects. 4. Body image disturbance related to surgical intervention or hair loss. 5. Anxiety and fear related to cancer diagnosis and prognosis. Medical management. 1. Surgery, tumor resection if feasible. 2. Chemotherapy, agents such as vincristine, acetinomycin D, cyclophosphamide. 3. Radiotherapy used in cases of unresectable tumors or high risk RMS. 4. Targeted therapy, investigational approaches using molecular inhibitors. Nursing management. 1. Pain management, administer prescribed analgesics and provide comfort measures. 2. Infection prevention, monitor for signs of infection, maintain strict hygiene. 3. Nutritional support, encourage high protein and high calorie diet. 4. Emotional support, encourage communication and coping strategies. 5. Education, inform patients and families about treatment, side effects and prognosis. Treatment options. 1. Multimodal therapy, combination of surgery, chemotherapy and radiotherapy. 2. Stem cell transplantation, consider for relapsed cases. 3. Clinical trials, new targeted therapies under investigation. 4. Palliative care for advanced or terminal cases to improve quality of life. 5. Rehabilitation, physiotherapy and psychological support. Psychosocial medicine. 1. Counseling and support groups helps patients and families cope with emotional stress. 2. Cognitive behavioral therapy CBT helps manage anxiety and depression. 3. Arts and music therapy encourage self-expression and relaxation. 4. School reintegration programs ensure continued education for pediatric patients. 5. Financial and social support services helps families manage the cost of treatment. Prevention. 1. Genetic counseling for families with hereditary cancer syndromes. 2. Avoiding radiation exposure, minimize unnecessary radiation exposure. 3. Healthy lifestyle, encouraging a balanced diet, regular exercise and avoiding carcinogenic substances. 4. Early detection, awareness of early signs and symptoms for prompt medical attention. In conclusion, rhabdomyosarcoma is a rare but aggressive cancer primarily affecting children and adolescents. Early diagnosis and multimodal treatment approach significantly improve outcomes. Advances in targeted therapies and genetic research offer hope for improved survival rates and quality of life for patients with RMS. Thank you. Have a nice day.